So, in addition to being a facial cosmetic surgeon, I'm also a craniofacial surgeon and pediatric plastic surgeon. As such, that gives me a great deal of experience in treating patients with vascular birthmarks, i.e., red marks, right? And so today I thought I'd show just an example of a patient who has a port wine stain that we're treating. Well, what is a port wine stain? Essentially, the other name for a port wine stain is a capillary malformation, which basically just means that as the baby was developing in the womb, they got some extra capillaries in their skin. And what this shows is a red mark. And we've all seen patients who have these red marks. So the treatment of the lesions is using a pulse dye laser. And that laser specifically targets red lesions. So in addition to port wine stains, it's useful for hemangiomas, for small cherry angiomas, little red bumps, for telangiectasias or spider vessels. So it's very good for all these. It only penetrates about a millimeter down into the skin, and as such, it really has a low risk of it causing any scarring or even pigmentation changes associated with it. So what we do is we come in, you don't need general anesthesia. You can do it just even without topical anesthesia because prior to the laser bursting, it also sprays a coolant. And so what it really feels like is getting snapped by a rubber band, which is not too bad. Most people don't need anything for it. They don't need any prep for it either, which is very nice. Afterwards, the lesion may feel like a bit of a sunburn, easily managed with some Tylenol. Um, Here's an example of that treatment. So if this is something you're interested in, don't hesitate to give us a call. And thank you for your attention.